Hello everybody. Today I'm going to show you some frequently asked questions of COVID-19 and schools. I took the reference from once again the WHO website. Link in the description below. The first question is, are children at lower risk of COVID-19 than adults? Children are less often reported as cases when compared with adults, and the illness they experience is usually mild. From data reported to WHO, children and adolescents up to 18 years of age represent 1 to 3% of reported infections, even though this age group makes up 29% of the global population. While children may be less affected, they may also have a greater number of contacts in school and community settings. So further studies are underway to assess this risk of infection in children and to better understand the transmission in this age group. The second question is, should children with underlying health conditions such as asthma, diabetes, obesity return to school? Whether a child should go to school depends on their health condition, the current transmission of COVID-19 within their community, and the protective measures the school and community have in place to reduce the risk of COVID-19 transmission. While current evidence suggests that the risk of severe disease for children is lower overall than for adults, special precautions can be taken to minimize the risk of infection among children, and benefits of returning to school should also be considered. Current evidence suggests that people with underlying conditions such as chronic respiratory illness, obesity, diabetes, or cancer are at higher risk of developing severe disease and death than people without other health conditions. This also appears to be the case for children, but more information is still needed to come. 3. What benefits would school reopening provide? The decision to open schools should include consideration of the following benefits: allowing students to complete their studies and continue to the next level, social and psychological well-being, access to reliable information on how to keep themselves and others safe, reducing the risk of non-return to school, and benefit to society such as allowing parents to work. 4. Does WHO recommend staff and children to wear masks at school? If yes, what type of masks? The decision to wear masks depends on the assessment of risk. For example, how extensive is COVID-19 in the community? Can the school ensure physical distance of at least 1 meter from others? Are there students or teachers with underlying health conditions? Fabric masks are recommended to prevent onward transmission in the general population in public areas, particularly where distancing is not possible and in areas of community transmission. This could include the school grounds in some situations. Masks may help to protect others because wearers may be infected before symptoms of illness appear. The policy on wearing a mask or face covering should be in line with the national or local guidelines where used. Masks should be worn, cared for, and disposed of properly. It is important that anyone feeling unwell should stay at home and always call their health provider. There are more questions answered at the WHO website, link in the description below. Thank you.